welcome to this episode of DMC Medical Matters. With us today is Dr. Joel Appel. Dr. Appel is a hematologist and oncologist at DMC Sinai-Grace Hospital. Dr. Appel, thanks for being here. All of us know someone who, in one way or another, has been touched by cancer. What is the impact of cancer on our community?
Well, it's devastating. Cancer has an emotional connotation. It's not just an organic or physical disorder, and all of us have been touched. I've had cancer in my family, my mother and father, my sister-in-law when she was very young with breast cancer, which is very much why I'm, or at least a part of the reason why I'm in the field of oncology, hematology, because of those experiences. So we know that in the local community, nationally, worldwide, cancer is always considered the diagnosis that's most devastating.
But what are the risk factors for folks when it comes to cancer?
Well, there are many, but it's probably fair to say that the biggest risk factor is lifestyle, and sometimes it's choices. For example, tobacco. We all know the effect of tobacco on risks for lung cancer, head and neck cancers. People don't even realize that bladder cancer and pancreas cancer are most tied to tobacco use. The risk with alcohol added to the mix in esophagus, head, neck, and other cancers, certainly that's a lifestyle choice. But another lifestyle choice is the foods we eat, our weight. And in this country, 2/3 of Americans across all sectionalities, across all ethnic groups are either overweight or obese. And there's no question that in terms of breast cancer, colon cancer, prostate cancer, many others, that the risks could be reduced if people would simply try to get their weight down to match their height and get to a safe level to reduce the risks of that. And then, of course, there are probably many unknown factors that are in play. Other foods that we may eat independent of the fats or the weight that we gain. Exposure to the elements. Viruses, for example, have been associated with Hodgkin's disease and other cancers. So there are many factors that we can do something about, some that we can't do a lot of things about. Certainly changes in the genes spontaneously without anything that we did wrong can lead to many cancers that are not necessarily associated with lifestyle. So things that we can modify and things that we can't, but we need to do a much more vigilant job of taking care of ourselves.
Speaking of taking care of yourselves, how important is it to get screened?
Well, it's critical because we know that screening saves lives. It doesn't save lives for all cancers, but it sure saves lives for many. And we know that with breast cancer, screening mammograms, prostate cancer, PSA blood tests that men should be getting, colonoscopies, now reduced to age 45 and above. That shows you how much of a concern we are with younger folks getting colon cancer, and the risk for screening at the needs to screen are certainly greater than ever. So I think that across the line, pap smears, many tests that have been approved by the American Cancer Society for screening, which will no doubt reduce the morbidity and the mortality and save lives from cancer.
Is there a take-home message as we wrap it up for patients and people who are maybe concerned about what their future holds in terms of cancer?
Well, I think that it is best to think of it this way, and that is, don't be afraid to get your screening test. Don't be afraid to take care of yourselves. Don't be afraid to go to the doctor. Those are the things that you should do to protect yourself. Be afraid if you don't do those things, because then the unknown lurks, and of course we know that patients that are good to themselves and do the right thing can reduce the risks of many diseases, and certainly including cancer.
All right, thanks, Dr. Appel. Thanks for the insight and the great information, and thank you for watching. For more episodes of DMC Medical Matters, Visit our website at dmc.org/medicalmatters.